Today our topic is polycystic ovarian syndrome, which is the most common hormonal disorder among women between the ages of 19 and 44. It affects up to 20% of women in this age group, and depending upon how it's defined, is one of the leading causes of infertility. I'm so excited that our guest speaker for tonight is Dr. Felice Gersh, and she is a board-certified OB/GYN, and she's also fellowship trained in integrative medicine. She's the director of the Integrative Medical Group of Irvine, where she sees patients. She lectures around the world at medical conferences and writes on various topics relevant to women. And her first book, A Functional Medicine Approach to PCOS, the name is PCOS SOS, will be released in a few weeks. So let's give a good hand to Dr. Gersh.
Well, thank you. So I'm going to have a secret hand signal about this.
Okay, so
This will mean, you have to look at my secret hand signal. This means change slide. Okay.
do I just push this button? Okay, yeah.
Okay, yes, you can. That means change slide.
Oh, okay. Little slow. Male PCOS. Can we talk about male PCOS?
That's next week. So for those of you who don't know me that well, I will share that I am very romantic. I love fantasy, and I especially love the cartoon romances of Disney. So I loved Cinderella and Sleeping Beauty, and one of my favorites was Beauty and the Beast. The problem I had was when I turned, about 18 and going on for the next 25 years, I felt like I was turning into the Beast, because every time I looked in the mirror, my face was broken out. Yes, I had PCOS. And I have never discussed that before with anyone until just recently. I felt it's never about me, it's about you, about the patients, but I felt that you should know that I have a personal connection to this topic. It really matters to me, and I have children and other relatives, because it tends to run in families. So I like to pretend, and I like to wear sometimes fantasy hair. This is my fantasy hair, because I always wanted big, thick hair. So, but when you're 24, 34, and you look in the mirror, and you find you're 50 pounds overweight, I was fortunate, at least I had the lean version of PCOS, but you find you're 50 pounds overweight, and no one is sympathetic. They say, just eat less. And you find that you eat less than anyone you know, and you wake up and you find your hair falling out, and acne that will not resolve with anything that the dermatologist gives you, that you're told just take birth control pills because you have no regular periods and they make you feel sick, and then you're told just take metformin and that makes you sick even more. You can't pretend you're a fairy princess. And every girl, every young woman, every single one deserves to have their dreams come true. It's very hard for women with PCOS to see their dreams come true. And that became one of my missions, to understand it. Because if you go and you ask the typical OB/GYN and you have PCOS, why do I have PCOS? Do you know what the answer is? I don't know. Well, I think we know now. And it's only when you know something that you can then help to define a solution, right? If you don't know the problem, how are you going to solve it? So by the end of our little time together, you'll understand this, and then you'll help me as you figure out also best ways to resolve it. So as was already mentioned, it's the most common problem regarding endocrine dysfunction of women. It's a lifelong disease. In fact, you're probably, if you have PCOS, born with it. We now know that girls as young as 6 or 7 can be detected as predisposed to PCOS because they'll have low levels of adiponectin and adipokine, as a hormone made by adipose tissue, even in early childhood. Many girls who ultimately develop PCOS have baby fat that doesn't go away. They tend to be chubbier, even though they don't eat more. They tend to have maybe more problems like develop tonsillitis or emotional issues, even as a young child. And 50% at least will have a parent with, a mother with PCOS. And sometimes, you mentioned males. Males can sometimes have some of the predisposing things that are related, like they may have more hair on their bodies and more balding. And that sometimes goes along with having a predisposition to having a girl child with it. So if we look at reproductive effects of PCOS, go back a couple of little slides, one more here. So just to show you, where did the name PCOS, Polycystic Ovary Syndrome? By the way, there are people around the world, like the organization I belong to, the Polycystic Ovarian Syndrome Society, also known the Androgen Excess Polycystic Ovarian Society. They're trying to change the name. But some of the names, it's very hard in medicine when they change names. They do that all the time, like interstitial cystitis. People don't let it go. How often do you ever hear people calling it burning bladder syndrome? Probably never. They still call it interstitial cystitis. So they're trying to change the name because they feel it's not representative of the metabolic dysfunctions. But many, but not all women with PCOS will have what's sometimes called a rim of pearls. Lots and lots of little follicles around the cortex of the ovary. And I'll explain to you why that happens. So that is a function of the dysfunction, or it's a manifestation of the dysfunction, not really a cause of it. So they're looking at changing the name for PCOS to something like metabolic dysfunction of reproductive age women. Who is going to say that? I voted against it, but we'll see. So that is where the name came from. And way back when I was a medical student, they thought the problem started in the ovary, but nobody really understood it. Way back in the 1930s, Stein and Leventhal discovered the syndrome that somebody named after themselves, and it was women who were very hirsute, lots and lots of facial hair, very overweight, probably a very specific subset of women with PCOS. And probably what they were looking at was maybe acquired adrenal hyperplasia even. This was in the 30s, so who knows what they were really defining. So we'll go ahead. So if we look at the reproductive effects, and that's why it fell into the lap of OBGYNs initially. And as we'll see, PCOS is so complex, involving virtually every organ system of the body, that nobody wants to own it. That's part of the problem. When something is too complex, then, nobody wants it. So look at the thing. So you have hyperandrogenism. You typically have high levels of either DHEA sulfate, DHEA, which it converts from, to, and then testosterone, one or both of those. Acne, often recalcitrant cystic acne, often on the lower part of the face with big, deep, painful cysts that are really, really resistant to treatment. And if you try Accutane, you will have at best a 30% improvement, much of which doesn't stay. And they already have, as we'll see in a minute, a lot of bowel problems, and it can really exacerbate it. So I never recommend Accutane for my PCOS patients.
Do you really see a lot of patients with high testosterone with PCOS?
I do. And very common to have facial hair, also hair on their back, on their chest, on their abdomen, very male pattern hair, sometimes pretty significant. But there's one thing that women don't want to do is wake up every morning and have to shave. It's very demoralizing. And it makes women, that's one of the problems with PCOS. It's not sexy. You don't have a lot of really beautiful celebrities with PCOS. And so people don't want to talk about women who have facial hair and thinning hair and acne and 80% overweight. That's why it has so little research dollars going into it. Less now than in years past, and virtually all of it into reproductive function, not into all the metabolic functions. It's like the most common endocrine disorder of women, and it's an orphan. It's really ignored. So you have chronic anovulation. For most women, they have very irregular cycles. They have the ovaries with the cysts, as we mentioned. They have very high rates of infertility, very high rates of miscarriage, pregnancy complications. New studies have come out showing higher rates of autistic children born to women with PCOS. You think they have high testosterone, they're going to have high libido. They have very low libido and very low self-esteem. And as we're going to see, it starts or ends, or both, you can look at it, it's a big circle, with receptor problems of hormones. So now if we look at the metabolic effects, they're huge. By age 40, a very significant percentage, about 40% of women have at least prediabetes who have PCOS. So there's a lot of insulin resistance, glucose problems, high lipids, obesity, and visceral. We now know that women with lean PCOS, if you get a CAT scan, they have a lot of visceral fat. So their body composition is abnormal, and they will often be insulin resistant, even when they're very thin. My first baby, and I ate very normally and healthy, was 9 pounds. My second daughter was 9'6". This is what happens. You get a lot of insulin resistance, and it gets increased in pregnancy. So I mentioned like close to 80% are overweight and obese with all this visceral fat. Hypertension is rampant. They have a lot of endothelial dysfunction, which I'll show you, a lot of fatty liver. So it's a really bad seed. So if we look at it, with this one. So here this shows a lot of the other things I didn't mention, a lot of autoimmunity, much higher rates of autoimmunity. And in fact, they also have higher rates of endometriosis and uterine fibroids. They all go together, unfortunately, and especially autoimmune thyroid. They often have other signs of insulin resistance, like the skin tags and the acanthosis nigricans, a lot of bowel problems. And we'll see why in a few moments. Their gut is not right. So there's a lot of irritable bowel syndrome, a lot of inflammation. We'll look at that. So they have a lot of joint pain, a lot of arthritis, tendinitis. They injure more readily. So when they exercise, they say, I'm going to exercise, and the next thing they know, they have a torn ligament. They're injured, they're hurting. They tear things in their ankles. A lot of mood disorders. Who here deals with mood issues? I know a bunch of you. Yeah. Lots and lots of mood issues in women with PCOS. Lots of vaginal infections. It's been shown now, and we'll look at a lot of these other things, that women with PCOS have an altered vaginal microbiome. They also have an altered mouth microbiome. We'll see, they also have a gut microbiome. They also have an altered skin microbiome, which is why they have no good resistance to infections in their skin. A very high rate of obstructive sleep apnea and higher rates of many types of cancers. This is pretty devastating, and on top of that, they often can't have kids. It's so painful. So if we look at this, like when I was in training, nobody knew where it began. But they started to learn, well, more recently, that there's issues with the pancreas, and then there's genetically, the pituitary has altered release of gonadotropins. There's typically high quantities of LH, luteinizing hormone, and very low levels of follicle-stimulating hormone. And we'll show you why in a minute. And then the fat tissue, as I mentioned, there's higher amounts, and they produce adipokines abnormally. They don't produce leptin properly or adiponectin properly. And the liver, very high rates of fatty liver, low amounts of sex hormone binding globulin, hyperglycemia. So you can see it's complex. And the muscle will often have fatty muscle and insulin resistance, which the muscle we know is very involved in glucose regulation. So, return. So what's causing PCOS? I'm going to tell you. It's a blend of exposure to endocrine disruptors in utero. The one that's been the most researched is BPA, bisphenol A. There's quite a bit of research. And this is what came out from the FDA. Oh, it's very safe, BPA. There's very low levels in the maternal blood. Guess what? It concentrates in the fetus. They now know that. So-called safe rate levels in the mother have nothing to do with the levels in the fetus. And how many chances do you get to make your hormone receptors? One. You can't say, let's do a redo. Let's remake the brain. Let's remake all our hormone receptors. So they're not, when you put in endocrine disruptors, and we live in endocrine disruptor soup, that's just BPA that they've done research on. How about all the phthalates, the heavy metals like mercury? Lead is an endocrine disruptor. And of course, organophosphates, pesticides, and it's just a mess, right? So all of these things are contributing to the explosion of PCOS, and you have a lot of stress in utero, and what's happening is that you have crazy hormonal fluctuations in utero because of this, and things are just not developed right from the get-go. So did PCOS just come out? Where was it all these generations, thousands of years? It turns out that PCOS has been around forever. And like many things that now are turned on their head, way back thousands of years ago, if you went back 20,000 years, if you had the genetics, because like we saw there's genetics are involved, if you had the genetics for PCOS, you had a survival advantage, and so did your children. So why is that? Because women with PCOS innately have a little bit of difficulty with aromatization. All estrogen comes from an androgen, like testosterone. Testosterone has to go through this enzymatic change, through aromatization, to turn into estrogen. And women with PCOS have a genetic mild defect in that they don't do that really well. So why is that a survival advantage years and years ago? It meant that they had mild reduced fertility. Mild, which was an advantage. It means that they didn't have babies all the time. They had more time with the ones they had to raise them and nurture them. So they would have plenty of children, but fewer children. And they had a little higher level of testosterone. That is a good thing, because just think 20,000 years ago, they had to run, they had to lift, they had to do things. The Olympic gold medalist women, 40% have been found to be PCOS. That little bit of extra testosterone is a survival advantage. And just think, maybe they were a little bit more aggressive, a little bit more outgoing. Has anyone ever met a XXX woman? They're very meek, very, very soft-spoken. They talk in like a little whisper. They're like super females. Well, a woman with PCOS is a little more aggressive, but not in a bad way when she has just that little bit. So what's happened is we've taken something that has evolved to be totally natural in women and an actual advantage, and we've turned it into a disease. So women with PCOS need to understand they were born genetically superior, but through environmental changes, right? Look what's happened. So we have to get them back on track. So they have all these different things happening. So how do I know this? There was paper research to prove it. A lot of the theories about PCOS are now being proven, which I'll show you. So what have they shown? That estrogen receptor beta, and when you mentioned beta, you know that it was going to come up. So we'll talk a little bit. The beta estrogen receptor is significantly higher than alpha. Now that is not a good thing, because as we'll see in a minute, it's alpha that regulates reproductive functions and appetite. It's all about metabolism. Alpha is predominantly about metabolism, and beta is in a lot, we'll see, in a lot of other organs. And yet, although beta was expressed more than alpha, it was still lower compared to controls. High, so we have an inequality, but still too low. And the alpha was also found to be too low. So the receptor function is too low. It's, you know, it doesn't matter what you have if the receptor isn't receiving. And as we'll see, women with PCOS not only have reduced receptor function for estrogen alpha and beta, they also produce less estrogen, because remember, inherently, women with PCOS aromatize into estrogen from testosterone less well. But now, because of all these problems that they have developed, they do it even less well. So just estrogen basics, we have 3 types of receptors: alpha, beta, and membrane. Predominantly alpha and beta are nuclear receptors, but actually not completely. We now know, just very recently, that they also work on membranes. So when you have a nuclear receptor, what that means is it goes into the nucleus, it binds there to a receptor, and then it ultimately creates a protein through transcription, right, on the ribosome. So here we have a new protein. That takes a lot of time. So it takes a lot of time. You may make an enzyme, but it takes a lot of time. The membranes, they create very rapid effect. They can produce things like kinases, very rapid effects. So you have this blend, and it's a very complex interrelationship. We now know that alpha and beta interact with each other. If you have a lot of beta, it actually downregulates alpha. So here you have a big imbalance, and you have too little of everything, too little functioning, and you have more beta than alpha, you're going to even downregulate alpha more. And remember, alpha is primarily about reproduction and metabolism. So it's a problem. So look what happens if you don't have enough estrogen, or if it doesn't work. Does it matter if you don't make enough or it doesn't work? You know that people can have low thyroid in terms of function, in terms of how they feel, and in terms of how they're working, and still have normal thyroid levels. And in fact, we know that this can happen because of receptor problems. Look at insulin, right? You can have plenty of insulin, and you still can't get the sugar into the cell because you have insulin receptor resistance. So think of it in that respect. So the women with PCOS have low levels of estrogen, and they have receptor resistance. So you probably heard people talking about PCOS with estrogen dominance. We need to never say that again. There is not estrogen dominance unless you think that having a little bit of estrogen and not ovulating so you don't make any progesterone is estrogen dominance. The reason I hate those words is that it sort of demonizes estrogen, and it makes it seem like they have too much estrogen when they have too little estrogen. And of course, if they don't ovulate, they have virtually no progesterone being produced by their ovaries. So when you have estrogen, you have energy balance. Estrogen prevents weight gain. What happens to women's weight in menopause? Does it go up or down? You got it. That's the same thing. What you're going to see is that PCOS and menopause kind of look alike. If you take out the hirsutism and the reproductive issues, the metabolic issues are the same because they're both manifestations of low estrogen in the receptors. So when you have estrogen, you have health of your adipose tissue, healthy pancreatic function, healthy liver, muscle, and immune function. There are estrogen receptors in all of these tissues. When you don't have estrogen, look what you have, metabolic chaos, right? In that pink column. Do those look like the same things that we looked at with the metabolic features of PCOS? Yes. That's the same thing as estrogen deficiency. These are just some of the different regulatory genes involved with estrogen. Guess what? They're everything. Estrogen is about life. Reproduction and metabolic health are like this. Why is that? Because did nature evolve so that an unhealthy, metabolically unstable woman would get pregnant? Of course not. Nature wants women to be pregnant successfully, deliver and survive, and be able to nurse their babies and care for their children for years. So they want only reproductively healthy women to get pregnant and metabolically healthy women to get pregnant. They're the same. Do anorexic women get pregnant? No. That's why the menstrual cycle is a vital sign of female health. And women with PCOS have very irregular menstrual cycles. Any woman of the reproductive age group with irregular, abnormal cycles, that's a sign of dysfunction. We should not cover it up by putting them on birth control pills. That is not fixing them, right? And I'm going to talk to you a little bit about birth control pills, the #1 treatment for PCOS. So all of these things have to do with estrogen. And if I had like 3 more hours, I'd go through each and every one because they're all critically important. So I'll just pick out a couple. How about prostacyclin synthase? That is very important for maintaining endothelial health and keeping arteries dilated and reducing platelet aggregation. Estrogen doesn't increase blood clots. Estrogen reduces blood clots. It's a crazy thing. Estrogen does not increase blood clots. But women with PCOS are hypercoagulable. So birth control pills increase coagulation risk, right? And so you're taking a woman who's already hypercoagulable and then putting her on a drug that makes her more. And they have a paper just come out just on this showing increased risk of blood clots in women who go on birth control pills with PCOS. It should not be given. That is just like giving a smoker birth control pills. We need to think of it that way. And do women, when they get older, have more blood clots than younger women? Yes. Why is that? Because they don't have estrogen. Okay? Estrogen controls the COX enzymes. COX-1 is anticoagulant, makes the blood vessels dilate. COX-2 is an inducible enzyme which causes vasoconstriction and increases clotting to save you if you're attacked in ancient times or now by a wild boar, and so you don't bleed to death or get an out-of-control infection, right? So these are our survival mechanisms when COX-2 is induced. Inflammation will induce COX-2, right? And now we live in a world of chronic inflammation. That's why COX-2 is upregulated, causing constriction, and that's why we have blood pressure drugs to block the production of angiotensin II, which is related to the COX-2 enzyme. So, and all of these are critical.
Talk about leptin.
Okay, so estrogen controls leptin. Okay, so women with PCOS do not make leptin properly. Leptin suppresses appetite. That's why women with PCOS have high rates of binge eating disorder. And you know what? There was a paper published showing that putting an estrogen patch on a woman with binge eating disorder can help to reduce it. Now you know why. Because the appetite centers in the brain are controlled by estrogen receptor alpha, and they don't work properly in women with PCOS. And adipose tissue, the adipokines of adipose tissue are controlled by estrogen. If you go on Google and you put in adiponectin or leptin and estradiol, you'll find lots of papers come up if you go on PubMed. The thing that's so amazing is that the researchers, the PhDs, have been turning out amazing data on the intricate relationship of estrogen and all the different enzymes and all the different hormones that interrelate and everything else, and the clinicians don't do anything with it. They must be like wanting to hit their head against the wall. They publish all these brilliant papers and nobody does anything differently. Estrogen is about mitochondria. Of course estrogen is about mitochondria. That's where you make energy. Energy is the life force of everything, right? You have to have energy to be alive. Estrogen controls the production of energy. Women with PCOS cannot produce energy properly. They're super good at storing fat. They're super bad at burning fat because they have mitochondrial dysfunction. So here, oh, go back one. So, one more back. Okay, so here it shows overnutrition. Now that will block. This is like the enzyme system that is really anti-inflammatory. Going down here, increased transcription of metabolic and mitochondrial genes, and then it leads to increased oxidative phosphorylation. That means burning fat. That's fancy words for burning fat. So then they wrote under it, increased lipid oxidation, burning fat, decreased lipid in skeletal muscle, because who wants fatty muscle, and decreased insulin resistance, obesity, and diabetes. When you have too much food, it blocks that whole pathway. Look, estrogen alpha and beta receptor to the rescue. See, it creates NO. You know what NO is? Nitric oxide. much of what estrogen does goes through the production of nitric oxide, cyclic GMP. So what do you get? All this good stuff. What happens if you don't have estrogen or you don't have the receptors? You're not going to get all that good stuff, right? You're going to end up not making energy, not burning fat, and you're going to be inflamed. So if we go to the next one, you'll see here, different paper, okay? What does it show? E2. E2 stands for estradiol. That's the estrogen we make in our ovaries as our dominant estrogen of reproductive life. That's why, clue, do not give biased if you treat with hormones, because biased is almost all estrogen receptor beta, and that's going to downregulate alpha. So I'm going to tell you why you don't want to do that by giving a powerful hormone like that. Because in pregnancy, you have a ton of estriol. So why is that? Well, the vagina is hugely estrogen beta receptor. So the vagina is a completely different organ when a woman delivers. If you stuck a baby into a woman who didn't have pregnancy, like some kind of magic. Remember, I love fantasy. So magically, I'm going to pick one of you, I won't really do that, and you're going to be full-term pregnant, but you didn't have any of the hormones, and suddenly you're going to be in labor. You're going to rip to smithereens because you haven't had all that estriol to make you super stretchy in the vagina. You know how a snake swallows a pig? That's like how you could be. You really stretch. You could not do that without estriol. No. That's why giving vaginal estriol can be good in menopause, right? Because it's very good for the vagina, but you're just giving it there. Okay, so what else does beta do? Beta works on the adaptive immune system. So the T and B cells, T-reg cells are controlled by estrogen, nitric oxide, and that's from beta. So what you want is acceptability of this alien that's growing in you, right? So you want to have dramatic upregulation of T-reg cells. And you want to have downregulation of the innate immune system. That's alpha. The innate immune system, like mast cells, macrophages, neutrophils, they're alpha. So your innate immune system is downregulated because you have so much beta. Remember I told you a high beta downregulates alpha. So now you have your innate immune system suppressed, and you have your adaptive immune system upregulated with high levels of Tregs so you don't kill your baby with your immune system. What if you do the same scenario in a post-menopausal woman? Well, you may know this, that women who are pregnant often have a remission of their autoimmune symptoms. That if they have MS or they have rheumatoid arthritis, they often get better, and then they get much worse after they deliver. That's because you're down-regulating the innate immune system. It's like your own natural immune modulator, like Humira or Remicade. But as a side effect, women who are pregnant are more prone to die from an infection, like the flu, chickenpox. I don't know if you know that, but we know that in OBGYN, that women who are pregnant are more prone to dying from infection. So, do you want to do that to your postmenopausal women? Do you want to down-regulate their innate immune system?
But isn't the biggest risk chronic diseases, and isn't heart disease really an autoimmune disease, and IBS is an autoimmune disease, and
so
hypothyroidism
I'm glad
is an
you mentioned
autoimmune
that.
disease? So
The heart has a ton of alpha receptors. You can't, this is the fact. If you are treating an autoimmune disease like MS, there is some data on giving estriol. But if you're just treating menopause, then you really don't want to down-regulate the alpha, because alpha is also about metabolic health. Alpha is about regulating your metabolism and your appetite. That's why women after menopause often have the night munchies. It also has a lot to do with helping to regulate your circadian rhythm. So this is the reality. As hard as we have to swallow this, we're not smart enough to micromanage estrogen receptors. So if we give an herbal product to help with symptoms, that's not the same, okay? It's like eating soy. It's not the same as taking the hormone itself. So I don't have any issues with herbals. I just have issues with giving estradiol. And so that's a totally side note, but I'm here, captive audience, I'm going to share. Oh, go back one more moment. So here, if we look at the estradiol, we can see that when you have upregulation of oxidative stress in a mitochondria, and you produce what? What do you make? You make superoxide, right? In mitochondria, they make superoxide, and you need the enzyme system, superoxide dismutase, to convert superoxide into hydrogen peroxide. That requires estrogen, because if you accumulate superoxide, you'll kill your cell and your mitochondria. So here's the electron chain oxidative phosphorylation. You need estrogen. Reducing reactive oxygens, you need estrogen. Okay. And this is just showing you the same thing. See, it says estrogen, estrogen. The red lines mean that you're blocking the bad stuff. So you're blocking oxidative stress, insulin resistance, NADPH oxidase. That's one of the few enzymes that is strictly inflammatory in the body. And if you don't have estrogen, you're going to end up with all these things, like it says, impaired insulin resistance, and glucose uptake is impaired. And then here you have increased lipogenesis, you're making fat, triglycerides, and you're having abnormal increased gluconeogenesis. That's what happens when you get a fatty liver. You just go crazy making glucose and fat. And you have abnormal fat tissue with inflammation and abnormal arterial health. That's why women with PCOS and women in menopause have very high rates of hypertension. By age 75, 85% of women in menopause will, by age 75, 85% of women, because they're all in menopause, will be hypertensive. And very high rates in PCOS. So you end up, for all these different reasons, you get inflammation, inflammation, inflammation. So if we turn to the next slide, we'll see, I mentioned to you that the immune system has estrogen receptors. I told you that the innate immune system is alpha, and that the adaptive immune system, like T and B cells, is beta. So what happens is, without estrogen, the innate immune system are like weapons of mass destruction without any control, because estrogen modulates inflammation and the response of these cells. It doesn't just make them not work or make them work, it makes them do the right thing at the right time. So without estrogen, this has been shown. This article was published in June of 2014, that the white cells, the mast cells, the macrophages of women with PCOS are like super sensitive. They explode with their inflammatory cytokines with far less stimulation. So if you have a leaky gut, which I'll show you, almost all of them now have. We now discovered that. That was just published in the last couple of years. Papers first came out of China. There's much more research on PCOS in other countries than in this one. We have, like I mentioned, very little research here. They showed in this other study that the women with PCOS, their white cells explode, and if you have leaky gut and you have endotoxin, LPS, coming out, you're going to have inflammation, exploding inflammatory cytokines. Women with PCOS have much higher levels of circulating tumor necrosis factor alpha and such. So this is a huge problem. They're like pre-activated, and then they explode and put out their inflammation. So the gut, so we'll talk more about that, because we now know that you have to have a healthy gut microbiome to have healthy reproductive functions. And of course, healthy everything, right? Because it's all linked. So the gut does everything. We now know that's considered actually by many an organ. It's our own organ that we've been destroying for a long time because people didn't understand. And now that we understand, it still doesn't matter. So if we go back to that, oh no, here, that's right, go to the next one. So here, what this is, these just came out. I put down 3 articles, 2016 and 17 and 17. So this is pretty new stuff. The articles that showed PCOS women have an altered gut microbiome. They do not have healthy gut microbiome. They're all dysbiotic. Now, I'm sure you probably know this, but in case you don't, estrogen is really important for gut health. Every cell in the gut has an estrogen receptor. The enterocytes, the enteric nervous system, the muscle cells, the The glial cells, the enteric glial cells, that's the immune system of the gut, they all are estrogen receptor containing cells. And when you go on things like birth control pills, if you're in menopause, or if you don't have proper estrogen, or if you have like glyphosate in your diet, or other endocrine disruptors that you're swallowing, okay, you're going to destroy your gut microbiome, and we now know that that's key to health. And so what they found, and here going back, that all of these are altered and decreased and correlate with waist circumference. Serotonin is controlled by estrogen, the production of serotonin. Serotonin turns, of course, into melatonin. And so women with PCOS have abnormal melatonin function as well. That's one of the reasons they have abnormal sleep. So there's actually a study of the PCOS model in rats. I don't know of any study yet being done in humans, but of course it needs to be done, that in the PCOS rat model, when they did fecal transplant, the rats got better. So that may be another potential help. This is sort of interesting too. I don't know if you've heard this, but the gut microbiome actually has a huge amount to do with our hormone production. So if you take a male and his fecal material and transplant it into a female, the female makes more testosterone. Isn't that like fascinating? Yeah, and women with PCOS have more of a testosterone microbiome. So we need to have some of those triple X women donate poop to our PCOS ladies. So this is actually from a paper that my friend Kelton Tremelin, who is a brilliant endocrine reproductive specialist in Adelaide, Australia. And the reason I became friends with him is because I was following the gut microbiome for years, looking for some paper to prove, because I believed that the gut microbiome was different in women with PCOS. And he published a paper, a hypothesis paper in 2012, saying that he believed the gut microbiome was different. And this was a picture from his paper, and that was in 2012. And I kept waiting for the proof of his hypothesis. So finally, in about 2015, I sent him an email, because he had his email on the PubMed article. And I said, "Excuse me, Professor Tremelin, are you ever going to prove your hypothesis?" And he emailed me back and said, "Let's work together." So I thought that was pretty amazing, and we actually got a study going, and we had all kinds of trouble with funding and getting it going, so we actually got a lot of it done. It never got quite finished and published, but we became really good friends. And I went and I visited him in Adelaide, Australia. We've been good friends ever since, and we're going to collaborate on a book together in the next couple of years that we're working on. So, but this is what he came out with in 2012. You eat a crappy American diet, high fat, sugar, low fiber, you get crappy gut, you get leaky gut, and you get elevated LPS, and so you have all this inflammatory stuff going on that increases inflammation. Of course, goes in the gut, goes right to the liver. We now know that the short-chain fatty acids are very important for communicating with the liver. When you don't have the right ones, you get all this liver inflammation. So you have all this liver inflammation that gives you fatty liver, and that even drives testosterone more. When you have high amounts of inflammation, that increases insulin resistance. A lot of you actually are poisoning, the inflammation actually poisons the beta cells in the pancreas, and that drives up IGF-1 as well as insulin. IGF-1 actually drives up testosterone production, so you have like a double whammy. So then you have more testosterone production, impaired ovulation, all the elements of hyperandrogenism, and all the catastrophe of being a PCOS woman. And then what he proposed in the next slide was fix it, like give them a right diet, probiotics, healthy diet, get them to produce the right short-chain fatty acids, reduce inflammation, get the gut healed, and you will increase from the gut GLP-1, glucoside peptide 1, which is a satiety hormone made by the gut enterocytes. You'll reduce appetite, you'll improve body composition, and you'll have return to normal function of the ovaries, and this can be done. I mentioned nitric oxide and Treg cells. So unfortunately, because of the situation, women with PCOS, this has been published, this is from 2017, a lot of new stuff on PCOS just in the last couple of years. Women with PCOS have reduced nitric oxide, and they have reduced Treg cells. That is another part of the reason why they have higher rates of autoimmunity. Lower Treg cell function and all that inflammation. They have higher levels of ADMA. I don't know if you're familiar with that lab test. I get it all the time. It's an indirect marker of nitric oxide. If you have inflammation, then it blocks the conversion of ADMA to its metabolites, and so you get a buildup of ADMA, which is a direct competitor with nitric oxide synthase, the enzyme that makes nitric oxide, so it blocks it, and you actually don't make nitric oxide, and you build up ADMA. And so there you have it. That's a lot of the problems. Nitric oxide is a very big issue. Oral contraceptives lower nitric oxide. This is 2017, and yet we give them to women with PCOS. How crazy is that, right? And it's worse, when we give them other stuff. Levonorgestrel, that is one of the most common progestins. That's in like low estrogen. It's in the Mirena IUD and such. Levonorgestrel. Studies show that it completely negates the benefits of nitrates and nitric oxide. It's terrible. So it is just a terrible thing that we're giving these toxins, these endocrine disruptors to women with PCOS who already are metabolically dysfunctional. So we know that there's crosstalk between the microbiome. So this is the most interesting thing that has come out. This is from 2016, that the microbes in our gut, our microbiome, they are circadian. You have different microbial populations depending on the time of the day. They kind of come and go, and they are circadian. So what do you think? Women with PCOS are messed up as well with their circadian rhythm. So we're going to see on the next one. So we have the master clock in the brain that sits atop the optic nerve sensing light and dark, called the suprachiasmatic nucleus. And it's influenced by light, dark. And so women, for example, if we focus on women who work night shifts or rotating work schedules, or they have social jet lag, meaning they intentionally stay up really late at night on a regular basis. They go to bed different times, and they have lots of ambient light at night, which will really suppress your melatonin. They have much higher rates of metabolic dysfunction, weight gain, depression, breast cancer. Who here has worked at night a lot? I delivered babies for 25 years. Yeah, so we're messed up. We really have to work hard to get our health back. And the gut, I already told you, the gut has clocks. Actually, every cell in our body has a clock. But these are key clocks. The liver has clocks. And by feeding, this is the back door to try to help women with PCOS, by giving regular timed eating, you can help set the clocks of your liver and your gut microbes, and that will help to create metabolic homeostasis, where women with PCOS are really metabolically chaotic. So disrupted intestinal circadian rhythms by irregular eating and late night eating. And a lot of these women have the night munchies because they're so dysregulated with their appetites. And we know that we are like two different creatures. We're day creatures and we're night creatures. At night we burn, see, lipid catabolism, and our leptin comes out at night to suppress our appetite, but not so well for women with PCOS. And during the day we're building. So we build and then we burn. But it's all circadian coordination of metabolism and energetics. This is all messed up in women with PCOS, as we'll see in a minute. This is just insulin. Every hormone in our body is timed. Everything in our body is timed. You probably know, you gentlemen, that your testosterone is higher in the morning than it is later in the day. Women's estrogen is produced more in the first half of the day than in the later half of the day. And they don't just come out in one giant bolus in the morning, it's ultradian pulses. So that's why when we give hormone in menopause, of course we're not mimicking ovaries. We're just doing the best we can, but it's not an ovary. So insulin is optimal, yellow, but see an adiponectin peaking here, but see then it turns into the suboptimal and then poorest. So This is dawn, this is noon, right? This is midnight, so this is 6 p.m. So what are you doing when you're eating in this orange zone? Should be bright red. You're doing bad things. It doesn't even matter if you're eating healthy food, because you're stressing out your pancreas, increasing your insulin resistance. So you should not eat during these hours. And women with PCOS do that. So this is just showing the circadian rhythms of so many things. See what happens to our brains? This is at night. This is like 2 in the morning here. 2 in the morning is when we have peak blood flow to our brain. If you're getting poor sleep, like women with PCOS, you're not even getting proper brain flow. Is it any wonder they have so much mood disorder? Their poor brains are on fire. They're not getting what they need. And by the way, you can see that urine flow goes way down. You have someone that is peeing all night long, they are metabolically dysfunctional. That is a big clue. Somebody says, I go to the bathroom all night long, there's a real problem there. So next one. So this is the circadian rhythm of cortisol, which you probably all know. It should be highest in the morning and lowest when you go to bed. Okay, but women with PCOS are flipped. They've actually studied that and found that many women with PCOS have highest levels of cortisol at night and low in the morning. So they feel better at night. It's like 9 o'clock, it's like, I feel better. I feel more awake. Guess who else has this problem? Women in menopause. There's so much similarity. So they feel better at night. In the morning, their melatonin is actually starting to it's still coming out. Their cortisol hasn't jumped up, and they feel like tired and groggy, and they're wanting to drink a lot of coffee. They feel crappy in the morning, tired, drained, and then at night they finally feel better. But that's not a sign of a healthy. There's no such thing as a night owl. That means their circadian rhythm is off. And remember, if you're living essentially in jet lag, you're going to have the consequences of jet lag, which is metabolic syndrome, depression, increased cancer, and so forth. And here's a study that was done of people who actually were experimentally flipped. Okay, for 8 days they had a flipped circadian rhythm. Look what happened to their leptin, went way down, 17%, and look at their insulin, went up 22%. If you have high insulin, you can't burn fat. All you can do is store it. So that's what women with PCOS do. They're very good at storing. They cannot burn because they're living in chronic jet lag. Keep that in mind about your menopausal women. They're also living in chronic jet lag. Keep that in mind. We'll go back one more. Just to show you sleep. Look what happens to sleep. That's why their brains are not getting the oxygen they need. Okay. And I put this up just to show you how complex the estrogen receptors are in the brain. Because metabolism and reproduction are completely one. So SCN stands for suprachiasmatic nucleus. That's where the master clock is located, atop the optic nerve. It shows ER beta. There actually is other data that shows that there's also some alpha receptor. Estrogen controls your clock. Your circadian rhythm, your conductor of it is estrogen. Now there are other receptors. There are receptors for cortisol and melatonin and testosterone, but they are not the controllers. But if they're screwed up, they can impact it. So like if you have chronic horrible stress, you can still dysregulate your circadian clock. The estrogen can't override. Estrogen cannot override severe chronic inflammation. That's why the breast makes estrogen. Did you know that? The breast makes estrogen in women who have very high levels of inflammation, including inflammation in their breast. And that's what gives them breast density on a mammogram. That's why that's a risk factor for breast cancer. It's a sign of inflammation in their breast, and it can be picked up on a thermogram as well. But that is not estrogen that's causing the problem. It's estrogen trying to put out the problem. The body is making all that estrogen, trying to quell that inflammation, but it can't do it. It was only meant for acute inflammation, like a breast infection in a nursing mom. That's why the breast makes all that estrogen, to suppress the inflammatory response of a breast infection in a nursing mom. It was not meant for chronic inflammation due to endocrine disruptors or estrogen deficiencies or inflammation from all the other things like a bad diet and sleep and stress that can cause inflammation in the breast. So, and once you get breast cancer, we did not evolve to have cancer. That's a new modern disease. We know how to put out the cancerous cells, but our bodies were not designed for full-blown cancer. So estrogen is about growth and nurturing and healing. Remember, estrogen activates platelets to heal you, and it will activate platelets to aggregate, to create blood clots, but only in the face of inflammation. It doesn't do it spontaneously. But in the face of chronic inflammation, estrogen is very confused. And if you have cancer, estrogen just thinks it's damaged tissue and it's trying to heal it. So it will nurture it and grow new blood vessels to it, because estrogen doesn't understand cancer. It's just trying to heal damaged tissue. It doesn't know the difference. So if we go back one more time, you'll see, just for one thing here, it shows the estrogen receptor alpha. These are the appetite centers. These are where the nutrient sensors in the body are. The peptins are the signaling agents to the part of the brain that puts out the gonadotropins. It's all interlinked. I just want you to have the take-home message. It's all interlinked. And of course, I already mentioned that women with PCOS have very high rates of anxiety and depression. Now you can see why, and they're associated with higher levels of inflammation as well, and women with PCOS have lower levels of brain-derived neurotrophic factor. That's not a good thing. So this just kind of shows you the link between the gut-brain axis, and how it links to the vagus nerve, the immune cells, the cytokines, and the inflammation, the short-chain fatty acids. And so that's how women with PCOS, by having an unhealthy gut, can end up with an unhealthy brain. So we know time-restricted eating, synchronization of our rhythms can lead to health. Unusual, irregular feeding, desynchronization leads to metabolic disorders. So how are we going to help our women? Well, there's just so much we can do. Let's look at it. The next one. So this is my approach. In my office, I have me. I have 2 naturopaths. I have a fitness specialist, lifestyle educator. I actually had an acupuncturist until last month. She decided she wasn't going to commute from San Diego anymore. So I have to get, if you know anyone that wants to do acupuncture in Irvine, let me know. We do skincare. I have a fitness trainer. We refer out for the hypnotherapy. I love guided imagery. That's sort of like a way into a hypnotic state. And we have massage therapy, we do aromatherapy, and we do vascular imaging. So of course I start with a very extensive history. I do a physical, we look at the nutrition, and so forth. Exercise. This is so amazing. We now know that exercise increases gut microbial diversity, and it turns out that that may actually be one of the key ways that exercise helps mood, by improving the gut diversity of the microbiome. But of course it does everything. We know that there's nothing that it can't do, and we know that even in elderly adults with decreased nitric oxide, their arteries get healthier. And sleep. We already mentioned sleep, so please have your women with PCOS get tested for sleep apnea. And then you don't hesitate to give them melatonin. It turns out that women with PCOS have melatonin receptor resistance, and that they have high output of metabolic products of melatonin, but they don't actually work with melatonin well. So you actually can give higher. There are melatonin receptors in the ovaries. By the way, the ovaries are circadian as well. Everything is. So helping your ovaries to get on the right time will help your women, help their ovaries to get on the right time. They'll help them to ovulate.
What kind of dosage for melatonin do you like?
Okay, this is what I start. Okay, so I start with a very small dose that I give like about 2, 3, even 4 hours ahead. I sort of experiment with it. I start with 0.5 to 1 milligram. And the purpose of that earlier dose of melatonin is to help it's like seeing the sunset. By the way, if you see the colors of the sunset, it programs the brain that it's evening and to start reducing the cortisol and raising the melatonin. So if you give a little bit of melatonin, it's like a trigger to tell your brain evening is coming. So I love to start with that little dose. And if they still don't sleep well, then I will go to a sustained release 3 milligrams. But you can even go up to 5. I actually don't typically go above 5. Now, there's studies with women who have like breast cancer. By the way, women with breast cancer have major gut dysbiosis. They have totally different gut microbes, and they have circadian rhythm disruption, women with breast cancer.
And the dosage for cancer is like 20
Exactly.
milligrams.
I recently talked to a
Right.
doctor who says he takes 50 every night, and apparently there's some papers associated with
You know, I would love to learn more about it. I'm always cautious about it. I wouldn't hesitate to go up to 5 and see how they do. We have some data on that in women with PCOS. We don't have data with PCOS, but yes, with things like breast cancer, they go up really, really high. And one of the things it may turn out that higher levels will be better because of the resistance of the receptors. But I've gotten women to ovulate and get pregnant just by adding melatonin to their regimen. So it's really interesting. This is a fantastic study of one. But I love this study. But no, nobody pays for PCOS studies. That's a huge problem. If you know any sugar daddies, send them my way. I have so many studies I would love to do. They did this study in Israel. They took women with PCOS. It was a 1-month study. They gave them 2/3 of their calories for breakfast, 1/3 for lunch, which leaves nothing, but they gave them a tiny little dinner early. In just 1 month, their insulin and testosterone levels decreased by about half. There is no drug that does that. If you can, because what are you doing when you give them most of their calories for breakfast? You're driving down that morning cortisol. You're helping to reestablish that proper circadian rhythm and metabolic homeostasis. This is huge. If you have patients who really are motivated, especially women who want to get pregnant, they will do anything. Look they'll do. Look how much money they'll pay for IVF. And by the way, I'm totally against taking women with PCOS and they can't get pregnant, throwing them into an IVF machine, because they are unhealthy. They have very high failure rates, and when they do get pregnant, they have very high complication rates. And we now know that the children are epigenetically modified, so they're not healthy metabolically from the day they're born. And never give metformin to pregnant women like they keep doing. Metformin is an endocrine disruptor. They have data out of Wisconsin. They had all the fish going weird in their waters, and they had a brilliant environmental researcher who said, what the heck is happening in our lakes in Wisconsin? So she went through all the lakes and all the drugs. They're filled with drugs because, you know, the water treatment plants don't do anything about the drugs. They just get rid of the bacteria. We never were designed to get rid of pharmaceuticals. So they found all these different pharmaceuticals. They kept doing research. She found it was metformin, you know, which is so prevalent. So metformin is an endocrine disruptor. If you put that in PubMed, you'll find it, especially with minnows and zebrafish. But you know what? It's an endocrine disruptor with zebrafish. It's an endocrine disruptor with you. So they did a study. This just got published in the last year. Women with PCOS on metformin, their children by age 4 have significantly higher levels of body fat than controlled matched children of women with PCOS. They are already metabolically dysfunctional. They're already almost destined to become diabetic, cardiovascular problems.
And metformin is now a favorite drug of some anti-aging
I
drugs.
know, please, what? You need to tell them it's an endocrine disruptor. I definitely love age management. Who here loves the idea of getting really old? No. Okay, let's put it this way. Who wants to live to be really old, but not decrepit? Okay. Who wants to be really old and decrepit? No. Okay, so we want to have proper age management. That is not the way. I'm going to show you the way.
Dr. Gersh,
This. Sure.
Can you explain a little bit more on melatonin's effects on fertility?
Oh yes, so the ovaries have melatonin receptors. So women who work at night, women who have circadian dysfunction because they stay up really late, they just don't have a regular schedule, and they have circadian dysfunction. They travel across time zones, like flight attendants. Reduced fertility. If you help them, of course you want to do the lifestyle things, you don't just give them a hormone, but if you help them by giving them some melatonin at the right time, you'll actually help set their clocks. Melatonin is a major feature of ovarian function. And there's more and more articles, and by the way, I can get you some articles if people want to read articles.
That would be great.
I have lots of articles.
And by the way, everybody who wants to ask a question, if you raise your hand and we're gonna have a microphone so everybody else can hear your question, that would be great.
I think melatonin is one of the new frontiers for fertility, especially because we have so much circadian dysfunction. And for PCOS women who are innately circadian dysfunctional, it's really a very important part. So this is what I mentioned. So a lot of people are going crazy with time-restricted eating. They think you should only eat for 4 hours a day, or, and they eat between like 2 o'clock and 6 o'clock. That is not the right way, guys, because you have to have breakfast. Take this message home. You want to have circadian function, take a hint from that Israeli study where they gave 2/3 of the calories for breakfast. You want to eat breakfast by 10 o'clock at the latest, preferably by 2 hours. You don't have to eat the second you get up.
Thank you.
All right, high five. I have to high five you. All right, because I have to fight people on this. Okay, so you want to eat no later than 10, preferably within 2 hours of getting up. You don't have to eat it the second you get up. And that will help set your clock. I cannot tell you how important the circadian rhythm is. The guys who discovered the clock genes won the Nobel Prize for medicine in 2017. It's like a big deal. So you do need to have fasting in terms of restricted not eating time, but it should be to breakfast. People forget that I can fast anytime I want. You can't and be healthy. You can do anything you want. You're not going to be healthy. And so you want to fast from dinner to breakfast, and all you need is 13 hours. If you're a female, and you fast for that's hard enough. But if you fast from dinner to breakfast for 13 hours, you will lower your risk of breast cancer about 70%. And I already told you, breast cancer patients all are circadian dysfunctional. They all have gut dysbiosis. So this is one of the reasons why breast cancer is prevalent. There's others, like the endocrine disruptor soup that we live in and loss of estrogen. Well, one of the reasons that women with breast cancer, of course, occur more in menopausal years is because women in menopause also live with jet lag because they don't have enough estrogen to maintain their master clock. So all the things I'm telling you for PCOS apply to your women with menopause. But you know what? It kind of applies to you guys too. So you can do it too. You should, of course. But, and here, okay, well, so anyway, so you don't need this. You don't need the 16-hour. The amount of benefit beyond 13 hours of fasting is minimal, and at a certain point it's going to go down. So if we go back one, okay, so here, guess what these guys are? Resveratrol, lipoic acid, berberine. They're fasting mimetics. You know what resveratrol increases? The problem with resveratrol is you need really high doses and it's really expensive. But in research, resveratrol triggers sirtuin 1. Have you heard of sirtuins? We need like more hours for that one. But Google it if you don't know the sirtuins. They're really critical for metabolic health. They're linked to energy production. They're triggered by fasting and fasting mimetics. And they're completely interwoven with estradiol.
Now, what happened with that research? It kind of like exploded, like dead-ended or something.
Oh no, it's still ongoing.
Problems?
For which with resveratrol or sirtuins?
Resveratrol.
Well, because the problem with resveratrol is that it's super expensive and you need really high doses. There was a study out of UC San Diego about 1.5 years ago where they gave very high doses. I'd have to look up the article again, but it was very high doses of resveratrol, and it lowered testosterone much better than spironolactone. It worked way better than spironolactone. The problem is the cost of getting all that resveratrol. I think that's what. But they did that study at UC San Diego that just came out a little over a year ago with PCOS and resveratrol. So
What's very high dose of resveratrol?
Oh, many grams. You know, like 20 grams. I mean, you have to get way up there. Who's taking that?
20
But you are taking that?
No.
Well,
now-
you could. You know what? If people can afford it, take it. You know, because the data is very. Or you know, you can do what I do. I fast. It's cheap. Well, or what I.
2,000 bottles of red wine.
Yeah, you could try that. But by the way, they did a study in Spain. They compared alcoholic red wine to non-alcoholic red wine. Guess which one was more healthful? The non-alcoholic. Yeah, sorry. It's not the alcohol, guys. It's the grapes. And exercise is a fasting mimetic. You get a lot of the same benefits of fasting with exercise. And guess what? If you combine them, it's even better. If you exercise on a fast, what does that mean? Like in the morning. If you exercise before you eat, you get double benefits of exercise.
Can you get berberine in pregnancy?
No,
Okay, thank you.
you do not. And you don't give berberine forever, okay?
Right.
Berberine is not, I never give berberine for more than about 6 months at a time.
What is it?
It's an alkaloid extract from a number of plants, like the Oregon grapefruit. So, but it is not something you want to take forever, and there's definitely some concerns in pregnancy. I don't give any herbs in pregnancy except one,
Which is?
ginger.
Well, outside of pregnancy, is the concern damage to the microbiota?
It goes beyond that. Actually, there's like a little that said it can affect, there's even some potential brain effects. So you don't want to use berberine like long term. But you know what? They use metformin long term. They actually have very similar effects. And you know, metformin is toxic to the kidneys. I don't know why everyone is in love with metformin. But I like berberine. See, I use berberine for several months, and by the time the people do better. You know, I don't like to give people like 100 supplements and then they have to be on them for life. First of all, you'll have zero compliance.
What about in breastfeeding? Is it okay in breastfeeding?
No.
What is the
What is
fear?
it? Yeah, what is it?
Yeah, what's the fear of giving it long term? Haven't heard.
Well, it does, like you mentioned, that it can actually, it's like giving antibiotics long term. It really is an antimicrobial. But it seems to have some other subtle brain effects that we don't want, you know, because these have effects everywhere. Nothing just works in one site. So I like to think of it as a few months of use. And during that time, you know, like if you treat gut dysbiosis or you're treating SIBO, you don't want to treat them forever. You know, so I like to think of it as a treatment course, not a forever thing. So I love plants. Okay, who loves plants? Okay, does anyone hate plants? Okay, so I hate. Okay, I hope I don't get stoned. I hate ketogenic diets. Okay, because it's not nurturing your gut microbiome. What I do love is periodic ketosis with fasting. You're not supposed to be ketotic because you ate fat. You're supposed to be ketotic because you didn't eat and you're burning fat, not because you ate fat.
There you go.
You like that? Good.
So people don't understand the ketogenic diet.
They do not, because you should be ketogenic because you didn't eat. So I love carbs, but not processed carbs and sugar, because our gut microbes, I used to be paleo because I didn't know about the microbiome. I didn't know I had to take care of those little guys. Now that I know it, I want to eat for them and for me. So I eat lots of fiber. Now, grains are not evil. I don't know why people are so down on grains.
But we're talking, this isn't working, we're talking about women with insulin resistance.
Well, okay, there are studies published that in 1 month on this diet, also known as almost like a macrobiotic, high grain, but this is a very low glycemic diet because we're dealing with high resistant starch. It's not turning into sugar. If you use processed grains and stuff, no. So this is like whole grains. Whole grain is not whole, grain bread. That's pulverized grain. It means that it's whole, not manufactured into anything. And you do that with beans and legumes, and lots of root vegetables, high fiber. And so but it's a very low glycemic diet, very low glycemic. And healthy fats, of course, nuts and seeds and olives, Some coconut, there's been some news about coconut, so I don't like overdo coconut. And, prebiotic foods, probiotic foods, green leafies. Green leafies have nitrates. Don't you keep here, am I doing something? That nitrates, people keep saying nitrates are evil. Nitrates are what comes from beets, beetroot, green leafy vegetables. That's how you make nitric oxide in your gut. Half the nitric oxide comes from your mouth. You chew the green leafy veggies and the beets, and it mixes with the mouth and the saliva and the reductases of the enzymes of the microbes in the mouth, and you make nitrites, and then it goes in your stomach where there's stomach acid and B12 and magnesium and such, and then it turns into nitric oxide. But you can't make nitric oxide in your gut if you don't have nitrates from green leafy vegetables and such.
Where do you place fruit on there?
Oh, okay. So, I'm glad. So, here's, do not be afraid of fruit. Do not be afraid of fruit. Fruit is not going to give you diabetes. People are not getting diabetic because they ate too many apples. It's not happening. Even bananas and papayas and mangoes, they are not giving people diabetes. It's all the poisons and the chemicals and the circadian rhythm dysfunctions and all. We're afraid of the wrong things. So I usually say, I'm glad you asked, I should put it in there, 5 veggies to 1 fruit. So if you eat 10 servings of veggies, you get 2 fruits. Okay, I treat fruit as a reward. So, although sometimes I'm going a little crazy and probably reverse that, but that's usually in summer, when you just can't help yourself. But that's okay, because you might put on some weight if you eat too much fruit, but you won't get diabetic because it will be fat that's stored not in your viscera. It'll be, if you're a girl, it'll be right here. So you'll look more like Kim Kardashian.
But there's quite a few low-carb studies right now on diabetes.
Oh, yes. So here's the thing. If you are demented, really demented, and you cannot metabolize, you can't transport, I should say. Okay, the GLUT transporters, GLUT4 for them into the brain. So guess what? They're actually controlled by estrogen, the GLUT transporters. So if you have poor glucose transport into the brain, you can still get ketones in. So I'm not talking about people with advanced dementia, okay? Now, if you have a person who has really significant dysfunction, like they cannot transport glucose. So really we're talking about pretty much like, because you can do what I just described for anyone who's pre-diabetic and early diabetic. But if you take someone who is really like end-stage diabetic, end-stage, like dementia, their GLUT transport system is so broken that they just can't transport glucose. They really can't, but they can transport ketones. So I'm not going to be against a low-carb diet for people who just can't use them. Just can't use them. They're so dysfunctional with their GLUT transport system.
I have a comment about the complex carbohydrates issue.
By the way, this is only for about 3 months. This is not a lifetime diet. This is my initiation diet for PCOS for 3 months. Okay, so this isn't like I'm telling everyone on the planet this is what you should eat. This is my 3-month initiation diet for women with PCOS.
What do you do after 3 months?
After 3 months, I start reducing the amount of carbs and increasing a little bit more proteins.
Okay,
so I balance. This is a vegan diet. So I start them out, okay, and then we'll come right to you. So if you have a dysfunctional gut microbiome, you cannot process animal protein properly. You can make nitrosamines, and which are carcinogens. You make TMAO from like carnitine and choline, things that are healthy, but because your gut microbiome is so abnormal, you're taking healthy foods and you're turning them into poisons. So that's why I start with a vegan, high plant-based diet, because the animal protein is not processed well. Just like people, it's not like normal days. So people who can't transport glucose, we have to substitute fats. For people who just can't metabolize animal protein, we have to get it out of their diet until they get a healthier microbiome and can do it. But go ahead.
Okay. I mean, some functional medicine doctors are recommending that for people with autoimmune disease, that they stay away from raw grains.
Okay, I disagree with that, and where's the data? Okay, I actually went on a search on PubMed. I'm a huge PubMed searcher. I could not find the data to support their contention that now, if you're going to eat moldy grain, I mean, I can see where they're coming from. They say, well, the grain is full of mold.
Well,
You know,
it's full of gluten, it's full of glyphosate.
oh, no, well, I would never, okay, so, good you said that. And I would not eat any grains that have gluten in them. I would not do gluten because gluten, I tell all my women with PCOS, especially they have acne, they stay away from all dairy and all gluten. Okay, I'm glad that, and they have to be organic grains. No grains should ever be glyphosate. I mean, who wants to eat glyphosate? But, you know, everything should be organic. So I emphasize that. I can't control it, you know, when people buy, but I tell them I would never have grains that are full of, and maybe that's what they're talking about, but the whole lectin, I mean, we could talk a lot about the whole lectin thing. I don't believe in that whole thing of lectins. I think that there may be some very specific cases where people are so sick that almost any food is going to be not tolerated. Okay, but for the vast majority of people, like if you look at India, for centuries, probably longer than that, for going way back, not now because they're all messed up in India, but before that, before we came on the scene with the American diet, they had the highest consumption of beans and lentils, and they had the lowest incidence of autoimmune disease on the planet. They had the lowest with beans and lentils. The Ayurvedic diet, which is cooked vegetables and cooked beans and lentils, is very healing. I don't know if any of you get into Ayurveda at all. It's a very healing diet. I think that there are special circumstances, but show me, I mean, I am open. I have changed my mind 1,000 times, so I'm totally open. Remember, I told you I was paleo, so I'm open to everything.
We gotta set this up. Gundry versus Gersh.
But I would love to see the data. Show me the hardcore data that show that you're going to aggravate autoimmune. Okay, I'll tell you the truth. I reversed my own autoimmune Hashimoto's, and this is how I did it. And I did it based on data, on nurturing the microbiome and the circadian rhythm, you know, and doing fasting. But you know what? I'm open to changing, totally open. Do you want to do questions? Sure.
I have a few questions. One is, how much fat are you recommending? About what percent?
Okay, because it's not that it's so little fat, it's just that it's so much carbs. So it's about 20%.
Okay. And then you didn't say too much about progesterone, and I'm wondering what are your thoughts about that?
Okay, so progesterone receptor function has not been proven to be abnormal, but I think there probably are cases now. In endometriosis, which is more common in women with PCOS, so there are probably variants. It's probably, you know, it's a syndrome. So it's probably, depending on the chemical endocrine disruptor, the timing, and so forth, there's a whole potential slew of different types of endocrine dysfunction within the women of the PCOS, including potentially maybe thyroid. But in women with endometriosis, this is definitely proven. They have progesterone receptor resistance. That's why giving progesterone in high amounts to women with endometriosis doesn't seem to help. It just doesn't. And you say, why isn't it help? Because it doesn't bind properly. They have tremendous problems with function of progesterone.
Now you're a fan of progesterone, just
Oh,
not
I love
for
progesterone.
PCOS.
I love progesterone. Now, I will give women who have PCOS, if they are making estrogen and they're not ovulating, and I'm trying to make sure that they don't get, by the way, endometrial cancer is much higher in these women. They have to be, while I'm trying to get them to get regular cycles, I can get almost every single woman with PCOS to have regular cycles. But until I get to that point, I will give them progesterone to withdraw. Okay, so I'll give 14 days, and I will give them 200 milligrams of progesterone at bedtime.
Orally?
Orally. But because I'm giving it, what am I giving it for? I'm really giving it to protect the uterus at that point. And then while I'm working to get them to ovulate naturally.
And then what specific form of, or type or brand or whatever of estrogen do you recommend? And also, do you how much do you rely on testing versus symptoms and?
For women with PCOS?
Yeah.
Okay, so usually with women with PCOS, I always test things like DHEA, sulfate, and I always test, testosterone, and I'll test their FSH and their LH. They usually have very high, like I said, LH. And let me just tell you quickly, why do they have very high LH? Because they're not aromatizing, their ovary, okay, so fecal lutein cells in the ovary make testosterone. The testosterone goes from those cells into the granulosa cells, where they're aromatized into estradiol. The problem in women with PCOS is that their aromatization is not working well. So they take testosterone and they don't convert it well to estradiol. So the brain has a feedback mechanism and it doesn't show enough estradiol. So the brain says, I don't have enough estrogen. So what am I going to do? I'm going to put out more LH to make more testosterone to convert to estrogen. But it doesn't do that. So the brain keeps pulsing out LH, but it making more testosterone, but it doesn't convert into the estrogen. But it keeps trying, and the FSH receptors are also malfunctioning. It's even more complicated. So the FSH receptors are malfunctioning, and it's FSH that triggers aromatization. So that's why aromatization is malfunctioning, and they have really high production of LH, low FSH, low estrogen, and then the low feedback, and they never get the high feedback. And for some women with PCOS, because they don't actually get a high enough spike.
Attention, please. The library will be closing in 30 minutes.
Oh, okay.
The second floor
the
restroom will be closing in 15 minutes. If you need a library card, please go to the customer services desk immediately. Thank you.
So when you have the high, okay, so you have the LH, the FSH. We'll just leave it at that. So in women with PCOS, what happens is it's the peak of estrogen that is the trigger for ovulation. That doesn't happen high enough, even when they do ovulate. It doesn't typically go up high enough, and it's that peak of estradiol that tells the adrenal gland that puberty is completed. Because puberty starts with the adrenal gland, and it starts making a lot of cortisol to increase appetite, put on weight, create some insulin resistance, and it causes production of DHA sulfate to then go to, so you make more fat with the cortisol, and then you convert the fat into you convert the DHA sulfate into estrogen in the fat. Okay, that's why you have to have a certain body weight in order to go through puberty, right? So that's the cortisol puts weight. Remember, 20,000 years ago, girls were pretty skinny, right? When they hit puberty, which was later. And so what happens is in some women with PCOS, the proper feedback doesn't ever get to the adrenal, so they never end puberty in their adrenal. So they keep making more cortisol and DHA sulfate. That's why certain subsets of women with PCOS have much higher amounts of cortisol and DHA sulfate, because they don't go through that shutdown thing that needs to happen. But, and then, what was your other question?
Which type of estrogen, and also for testing, do you tend to rely more on blood or urine? Or
for
saliva?
basic tests, I do blood. Now, you can also do blood spot, or you can do dry urine if you're trying to do like a daily. Like if you want to do like a urine test, like ZRT or Dutch test, and you want to do daily. But usually I only do that for women who are trying to get pregnant, because otherwise I just can tell if they're having regular cycles, then they're obviously ovulating, and I also can have them do like their own like ovulation testing and so on. So it's a lot cheaper than constantly doing daily testing. How many months are you going to do that? So, but for just general screening, I do blood. For women who are not on hormones, the most data is for just blood testing, just regular any lab blood testing.
And what type of estrogen?
Oh, well, I don't. Okay, if I'm giving estrogen, it's really off-label to give like hormone estrogen to women with PCOS. But if I do compounded.
So you don't necessarily give estrogen?
Well, I try to get them to make it themselves. So I do these other things. I have given rhythmic estrogen just because what I'm trying to do is sort of reprogram their receptors. We need studies. I'm working with a nonprofit that's going to they're trying to raise money to do studies in Mexico where it's a whole lot cheaper. And I'm part of a whole hormone symposium that's in Irvine, November, whatever, like 10th and 11th. If anyone's interested, they can come or contact me if you want to come to a hormone prescribing conference. It's going to be very comprehensive.
Do you have a endocrine disrupting substance strategy?
The number one is avoidance. And they have done studies on women with PCOS, and they tend to bioaccumulate more. So I've done a little bit of studying on just my own, and they tend to have more methylation defects. They're bad detoxifiers. So, that's one of the problems, is that I find a lot of them are the TT, MTHFR, and COMT. They're just bad detoxifiers, and then they tend to, not only have they had more exposure in utero, they bioaccumulate more while they're living their lives. So number one is avoidance. Like BPA is very short-lived. The body gets rid of it really fast. The problem is we live in BPA soup. So, of course I say stop going to Starbucks and having those plastic lids that you're drinking through. Of course, those are also phthalates. But don't get takeout containers of food. Do the best you can to lower exposures. And then, I do the general same stuff like everybody else. I give a lot of NAC, and I give glutathione, and I use chlorella. I think avoidance is number one, and then just healthy gut and healthy liver. Because if people have fatty liver, they're not doing all the conjugation, methylation, sulfation. They're not doing all those functions properly in a fatty liver. So I really focus on avoidance and healthy gut, healthy liver, and then the standard stuff. And
We have a question there.
sure.
Just on your feeling about the association between endometriosis and PCOS, you mentioned the association, but just like you're talking about a high percentage, it's about that same percentage you hear from the experts on endometriosis. They say it's way underdiagnosed, people don't recognize it, it's microscopic, it's birth, all the things you just said about PCOS.
Well,
I hear about, right, 25% of the population maybe.
I call them women's unique issues, are underappreciated, understudied, and poorly treated.
But what's your feeling about, off the record? I mean, I know you don't have research to back it up, but your feeling about the 25% of women PCOS and the 25% of women who might be endometriosis, is there a lot of overlap, or are they the same women?
No, they're not all the same, but there is a lot of overlap. And I have a whole slide presentation on the links between PCOS, endometriosis, and fibroids. It's because they're now with endometriosis, it's felt to be very heavily related to endocrine disruptors in utero, in genetically predisposed people, and they all have autoimmune components. It seems like everything has some sort of autoimmune component as well, and so it's, and you can listen to our interview.
Yeah, we did an interview on endometriosis on my Rational Wellness podcast.
So, but endometriosis is very underdiagnosed, and the problem, there's a new drug that just came out. It's just a variant of Lupron, and it's only approved for 6 months, and it's super expensive, and they're making such a big to-do about this drug that the thing that they say is so great, it shuts off the entire production of women's hormones, but not as severely as Lupron. That's their claim to fame, and it's only approved for 6 months. Come on.
It's so hard to avoid the BPA, those cash register
I
receipts.
know.
You buy BPA-free paper and it's recycled paper, and some of the paper that goes into the recycled paper has BPA in it, even though they don't add more BPA.
So this is what I do.
Instead of BPA, they use BPS, which is probably just as bad.
It is so terrible. We have plastic, you have a Keurig, you're running your coffee through plastic in hot water.
Horrible.
Oh my God.
They get mold in them.
Oh, they get mold too? Okay.
Because they never dry. They never dry.
Good to know. I don't use mine that I got as a gift. It's just sitting there. I don't know why it's sitting there. I just get rid of it. I'll put it in the toxic waste heap. But we eat so much plastic, and everything is plastic. It's really hard. But for the receipts, I carry a Ziploc bag, and I just tell the poor person, I tell them, I say, you know what, you should wear gloves and put it in this Ziploc baggie. And then I take gloves home from the office. But that's look, do I live in a toxic world? I know. I'm going to get Genova Lab has a toxic effects test. And I've run it, it's super expensive. It's like $700-800. But I got it on my husband. He was so full of BPA and organophosphates. Like, what happened to you? You know, and I was going to do me. That's for the new year. I'm going to test me and see where I'm at.
The Great Plains toxic test is a lot cheaper.
I'm going to switch over to
Urine
that
test.
one. Yeah. Thank you. I'm going to switch over. Save some money for me. Yeah. So, okay, so I love resistant starch because resistant starch, look at this. This is from 3 years ago. Improves appetite, cognition, gut barrier function, reduces oxidative stress, inflammation, and it improves your ability to detoxify your stupid endocrine disruptors. Oh, so resistant
Ultra
starch.
glucose control from metagenics with resistant starch.
That's true. That is true. And so, see, it increases, butyrate. I love butyrate. I use that. And increases GLP-1, so the appetite gets better. So things that are resistant starch are plantain. If you eat cold potatoes that are cooked, this is like so you eat like little organic like new potatoes, and you boil them just so that they're just soft enough to eat. And you mix them with like your own balsamic vinaigrette and you eat it cold, pure resistant starch. Green bananas are resistant starch, plantain resistant starch. And there's some supplements that are resistant starch. And look what they do. Like, everyone should be doing that because look, just what we were talking about. And next. So, you have to eat across the colors of the rainbow. It's like a dance of the microbes with the polyphenol. They each like match. I picture like there's some on that side of the room, like remember like junior high dance, and you have the boys on one side and the girls on the other side and then they're supposed to sort of match or something. Well, that's how it was when I was in school. And so it's like that with the polyphenols and the microbes. And so it's like an assembly line, you need to have all of them mixed together and it's just like magic. But if you eat, like if you say, oh, I eat vegetables, I have broccoli and carrots. Good, but not sufficient. Not at all. You need to eat lots and lots of variety of colors. And the polyphenols are just like magic. And, I use my polyphenols. I should mention quercetin. Quercetin is amazing for women with PCOS. It stabilizes the mast cells, which are the first line defenders of the body. They're the ones that put out the chemokines that call in the troops, the other inflammatory cells. So if you can calm down the mast cells, you can calm down the inflammatory response. So quercetin. And you know what fruits have quercetin? What's my favorite? Apples. So everyone should eat lots of apples. Won't give you diabetes. It will be good. Tell your PCOS women to eat apples. These are some of my favorite teas. I put this in the middle. Spearmint tea proven to lower testosterone. So have your PCOS women drink spearmint tea regularly. And ginger is so good for the gut. Tulsi, holy basil is good for mood as well. Chamomile, good for the gut. Green tea with ECGC, it has some really good data on it as well. So I'll let you move on. So anyone who wants my protocols, you can also go, just ask me. I'll give you anything you want, okay? So
Are you willing to share your slides with us?
I am.
Okay, so maybe you can send it to me and I'll send it out.
And if you buy my book, I'll even like you more.
You know what?
Oh yes, my book.
You can find them I put a link to my website where I put the slides. For some reason, you can't email a large PowerPoint, so that's why I'm having trouble.
Yeah, somehow it didn't work.
Do a Dropbox.
But so my
How do I
book.
get that to everybody else though?
You send the link. You send the link.
Okay. Okay.
Someone has to show you how to do it.
Okay.
So I don't know if you all got my little postcard. My book was supposed to be done by the fall conference season, and it didn't. But it will be. It's almost done. And it turns out it takes a long time to put it into book format. So it will probably be out in January, which is, I guess, okay. It's called PCOS SOS, a gynecologist's lifeline to naturally restore your rhythms, hormones, and happiness. And so if you want it, You got it. I hope you'll get it. I'll probably do a book launch where it'll be like one of those crazy manipulative things. I just learned about.
You want to talk to me?
Okay, we have to make it, everyone has an Amazon bestseller, so I have to figure out how to do that. So, maybe it'll just be, I don't have to do anything,
You have to
it'll just sell itself. So, these are like NAC, by the way, NAC is amazing for women with PCOS. You can push it up to even 900 3 times a day. Okay, and you can help people, of course, the probiotics, the prebiotics, the gut healing. Okay, and then I try to keep it so that I don't overwhelm them. This is my basics, but like I add in a lot more stuff. Like I said, I don't have the melatonin in here, but I use melatonin a lot more now. And so inositol is myo-inositol.
What about the combinations with the D-Chiro?
Okay, so I don't use that new combination where it's like 30 to 1. First of all, come on, it's a little capsule. How on earth are they controlling for a ratio? What?
It's supposed to be 40.
Oh, 40 to 1. Yeah, 40, even worse. 40 to 1, so you have 2 specks in this entire capsule, and who says that when you swallow it, it's going to get into your ovary in the same ratio? Where is that coming from? Anyway, it just jacks the price up. There's a lot of data on myo-inositol. By the way, high levels of D-Chiro is actually toxic to the ovary. So you never want to take straight D-Chiro, that's for sure. If you want to spend money getting something that's 40 to 1, do it, but I think it's wasting your money. NAC, quercetal. I do use some resveratrol and multi-omega-3, curcumin. Women with PCOS tend to have very low levels of vitamin D, very low. Many of them have vitamin D receptor issues too. But so definitely jack up the vitamin D to whatever you need based on their levels. And so here's like some of the other things. I like to increase nitric oxide, so there's a number of different products that can elevate nitric oxide, melatonin, lipoic acid, which is also, and there's a new paper that just got published a week ago that showed that giving selenium helped reverse the ovulation in women with PCOS. So I'm adding selenium. So basically, what you have is to make things right. And I was going to mention that I do use the fasting mimicking diet on my patients who qualify, which is most of them. Because that fasting, remember, you can do just water fast for 4 days, or you can use fasting mimicking diet. That's Prolon, that many of you know about, that was developed at USC in the Longevity Institute. Because it's very helpful. It really lowers inflammation, visceral fat, increases brain-derived neurotrophic factor. So I love to use the fasting mimicking diet. If they want to do water fasting for 4 days, that is also good, but very hard to get anyone to comply with that. I mean, who's fasted for more than 1 whole day? Better than me. But I've done the fasting mimicking diet 13 times. That's really easy for me to do.
Once a month for 13 times?
No, I've been doing it over the past 3 years. You start with every month for 5 days, and then you individualize it. I'm doing it like every 3 months. I'm reverse aging.
Good for you.
And so what you do is you get proper light, suprachiasmatic nucleus, we want to get our circadian rhythm right, our HPA axis, we want to deal with stress, get our autonomic nervous system so we don't have, women with PCOS tend to have higher sympathetic versus parasympathetic. We don't want to put out problems from our adrenal, too much cortisol. We don't want fatty liver. We want to have love, relationships, good healthy brain. We need melatonin. We sometimes don't want to eat. See that empty plate? Sometimes we don't eat, but we don't eat at the right time, and we eat at the right time. And so you put it all together, and women with PCOS can live their happily ever after life. Thank you.